I'm Katie Pryor. I'm dialing in from Bathurst today on Wiradjuri country. I work at the Western PHN, and we're really pleased to be working together with the LHD and the Public Health Unit to bring you these sessions. For today's first session for 2024 is Japanese encephalitis vaccination, Arbovirus, and Mozzie bite prevention. Before we move on to our learning, I'm going to hand over to Mervyn Holmes-Whiten, who's the Northern Sector Manager for Aboriginal Health with the local health district, for our acknowledgement of country. Thanks, Mervyn.
Thank you so much, Katie. So as Katie mentioned, my name is Mervyn Holmes-Whiten, and I'm the Northern Sector Manager for Aboriginal Health and Wellbeing. I work in Dubbo, based in Dubbo, and I'm a Condo boy. I'd like to acknowledge and pay my respects to Aboriginal people, both past, present, and Aboriginal elders, past, present, and leaders emerging, and also pay my respect to Aboriginal and Torres Strait Islander people present in today's education session. Thank you so much, Katie.
So just a little bit of housekeeping for everybody as well. I've already mentioned we just put everyone on mute, but of course questions and yarning are encouraged. So when you want to talk, just take yourself off mute, and we really welcome everyone's discussion today. We are recording just the education piece today so that anyone who mightn't have been able to be here or wants to review, we can make that available, but we will turn off the recording for the yarning session at the end. If everybody can type their name into the chat, particularly if you've got a number of people sitting at one device, just so we can capture everyone's attendance. This session is accredited with NATSIWIP, so for your professional development, it's for 1.5 hours. So having a good, accurate record of who attended means everyone can get those points. And we'd also love you to do an evaluation at the end. Let us know how it went. Let us know what you want next or any improvements we can make. Your feedback is always very, very welcome. So thank you all. So we've got a fantastic lineup of presenters today. We've got Belinda Tracy, who's the Acting Manager, Immunisation and Communicable Diseases with the PHU. We've got Kathy Hallahan, the CNC for Communicable Diseases with the PHU. On the Q&A panel, we've got Mervyn Holmes-Whiten, who we just heard from. We've also got Trixie Watts, who's here from the PHN. And our yarning session will be led by Alice Gordon and Wendy Holmes, who are with the Aboriginal Immunisation team at Public Health. Thank you all so much for your time today. And now we'll get started.
Thank you so much, Katie, for that introduction, and to Belinda and Erica for inviting me to chat about Mozzie's, Japanese encephalitis. I'm coming from Wiradjuri land this morning in the Bathurst office, and I would just like to also pay my respects to traditional custodians, both past and present, and acknowledge the Aboriginal people of the nation that we have the privilege to live and work on. Thank you. Can we just have the next slide? So today we're going to have a chat about arboviral infections and also a bit of a background just on the particular arboviral infection, which is known as Japanese encephalitis, JEV for short. We'll talk about surveillance, the notification process, public health management, Mozzie bite prevention, and Belle is also going to discuss the vaccination. Next slide. Thanks, Erica. So what are arboviruses? They're infections transmitted by mosquitoes to humans. There are over 500 recognised arboviral infections worldwide, 150 of which are known to cause human diseases. We're only worried about 8. So, you know, in all the world and all the mozzies that transmit infections, the concern in Australia specifically are 8 arboviral infections. And they're notified under the notification, which is the National Disease Notification Process. And these include the alpha viruses, which are very common to our area, Barmah Forest and Ross River. Ross River is our most prevalent arboviral infection by far. And then we move into the flaviviruses. I love saying that. It just rolls off your tongue. These include Japanese encephalitis, Kunjun, Murray Valley encephalitis, and malaria and dengue. And I'm sure you've probably heard of a lot of those arboviral infections. And I probably thinking that malaria and dengue is something that you hear a lot about, although we don't see a lot of malaria and dengue in New South Wales or in Australia. And most of our notifications are from people who have travelled and been bitten while they've been on holidays. So whilst they're really, for other areas of the world, they're not a particular concern at this time for us. The other thing with arboviral infections is it causes a variety of illness, and the thing with the illness is it can go from very mild to very severe, including, such things as fever, headaches, debilitating joint pain, to encephalitis, and unfortunately, in very rare circumstances, death. There's a lot of illness in between when somebody gets infected by an arboviral infection, and those are the things that quite often you don't know a lot about, because people get bitten, and if they get, say, infected with Ross River, which is our most prevalent notifiable arboviral infection in this area, they may get the infection and initially become unwell with mild symptoms, and they might go to the doctor and get tested, but it may not be until weeks after the infection, the initial infection. And for some people, that illness can actually go on to cause a chronic fatigue type syndrome. So there is evidence to support that, once infected, most people go on to, clear the virus, but some can go on to have debilitating long-term effects from, Mozzie bites. So whilst we have a mild disease and a severe disease, there's the disease in between that can cause those long-term health issues that nobody wants to deal with. Okay, so next slide. So the arbovirus disease surveillance is what we use to actually determine what we're seeing with regard to, the number of mosquitoes, the amount of disease that's circulating, what that disease is, and also what is happening in the environment to actually determine why we're seeing what we're seeing. So just briefly, the human cases are who the public health surveillance team look after. So we get notified of arboviral infections to the public health unit so we can count those diseases. Not all diseases notified are confirmed cases at the time. So it's a bit of an investigation process and a bit of a determination as to whether the ones that are notified are new or past infections, and that's part of the public health follow-up. The syndromic surveillance for ED presentations of encephalitis particularly is looking for that severe spectrum of disease where people present to the emergency department anything from, severe headaches to, obviously more severe inflammation of the brain, which shows up on the surveillance network with keywords that people look at, and then they identify, if this person needs to be further reviewed. The other one is the sero survey. Excuse me, just having a drink. The sero survey. So we did this a couple of years back where across a few LHDs, 5 regional towns in New South Wales were tested, so people volunteered to have blood taken. Those towns were identified by the Ministry of Health, and people turned up to the centres to get their blood taken. And what that allowed us to do was identify who in the community had previously been exposed to Japanese encephalitis. So that was, quite an interesting program, and gave us an understanding that, quite a number of the population had been previously exposed and didn't actually know that they'd been exposed. So that's sort of circling back to that mild disease where people get bitten and the majority will go on without even knowing that they've been exposed to many of the arboviral infections. And the other, environmental health use programs to test the mosquitoes and monitor for disease. I'll talk about that a little bit more in the next slide. And from that, the New South Wales Arbovirus Surveillance and Mosquito Monitoring System is a system that puts all the information together so that you can go on to their website and you can see at a glance what we're seeing and where the mosquitoes are and what viruses are being transmitted. So just to cover off this slide, so the surveillance is a really important aspect of the program in how we use the data, what we do with it to determine where the places that we need to concentrate on require our assistance with the programs that we put in place to help with prevention. It's also a bit of a early warning signal in where the circulating virus might be. We'll move on to the next slide. Thanks. So just a bit more on the New South Wales Arbovirus Surveillance and Mosquito Monitoring Program. It, as I said, acts as an early warning system for Mozzie's activity and arboviral infections. So the program runs from spring to autumn each year, and it involves the trapping of mosquitoes for virus isolation, species type, and how many mosquitoes they're seeing. And what they actually do is they trap a whole heap of mosquitoes using carbon. I think there's a spray that they use to attract the mozzies into a trap. They get as many mozzies as they can in the trap, and then, they humanely squash them and send them off to the lab. And the mozzies are tested as a sort of squashed entity, I suppose. In identifying, you can imagine trying to draw blood from a mosquito just wouldn't work. So in this, what we get is the biggest bang for our buck, where we get lots of mosquitoes and we can test a whole lot at the one time. And from that testing, that then talks back to our surveillance program. The other things that we do is the environmental team have sentinel chicken flocks, and they're positioned around the far west and western New South Wales. And so those chickens obviously out in the environment get bitten by mozzies, and they're tested routinely to see if any of the subsequent mozzie bites has resulted in an infection. And the other thing too that is monitored is in the environmental conditions that are required for breeding of mosquitoes, which we know is the rainfall. So if you have lots of rain, you can then say that the next season we're going to have a really high incidence of arboviral infections because there's just going to be more mozzies circulating. So it's a really, I think, combined approach, the surveillance program, where it really highlights the collaboration between the Public Health Unit, the Ministry of Health, our environmental colleagues, and we will all work together to provide the information to the public. And the surveillance that I'm talking about, so the sentinel chickens as well as the mosquito trapping, is in communities such as Balranald, Menindee, Wilkenya, and then the 6 sites that are listed there: Bathurst, Burke, Caraforbes, Macquarie Marshes and Walgett. And these sites have been, identified because we know that there is quite a lot of activity, so we need to keep them, monitor what we're seeing. So what we know is that the mosquitoes that are circulating, whilst they may not carry all of the viruses, the ones that carry Ross River and Barmah Forest, we do know that they can also carry JEV, but they don't carry malaria and dengue. So the type of mosquito is really important. So once we identify an area that we know is a concern, then that's where the surveillance program helps us to determine if there's an issue currently. I'm going to move on to some data. So the demographic and geographic profile is again another surveillance tool in itself. So it's really important to understand who gets arboviral infections, what area, as I just suggested, they were being caught in, and where the population, where they work, and what sort of things they do. So the information that you can see is a 5-year trend from 2019 to 2023. And as I said earlier, Ross River was the most notified arboviral disease notified, which was, I think, 92% of all of those notifications, followed by Barmah Forest, very, very similar arboviral infection. And then dengue was the next most notifiable, but only 4% of cases. And dengue, we haven't had a local identified case of dengue since I've been working in public health, which is 15 years. All cases that are notified across or to the public health unit have had overseas travel, either recently, if it's a new infection, or have lived and come from a dengue endemic area. We do see dengue in the top far north of Queensland, but that is being monitored from their public health unit. And just as an aside, one of the things that we do watch out for with a disease like dengue is what we don't want to see is dengue cases being notified in our area. So if people have travelled, one of the questions we do ask is if they have been to far north Queensland during their incubation period. And the reason we ask that is because if a mozzie bites them, then the possibility of that mozzie then passing it on to somebody else in an area where the mozzies are prevalent that carry dengue, then yeah, we can have an idea if any further cases were to result as a result of a person being infected with dengue being in far north Queensland. It's also interesting to look at, for this, more females than males are being presented or notified. And that's quite unusual. In the historical data, I think you would have seen more males, typically because males predominantly work outside and hold more jobs working outside. And so 52% were females and 48% were males that were notified during that period. And I'm not sure what the rationale is for the increase in females. It's a question that we could, put to look at. But yeah, I think my thoughts on that is that we're just seeing a lot more virus circulation, and the environment with the rainfalls and the different trends are putting more people at risk that maybe weren't at risk previously would be my take on that. But that's certainly not backed up with the evidence. It just is what you know, I think my experience with arboviral infections. There's a majority of cases are non-Aboriginal, and 9% identify as Aboriginal. 77% of notifications were of a working age, either, i.e. 15 to 64 years. And of all the government areas, the highest were that we saw notifications were in Dubbo, which had 14%, Forbes, and that was 11%, Walgett 7%, Wentworth 7%, and Warrumbungle Shire was 5%. We do see, and I do know that Forbes and the Cabone area, that we do see a lot of Ross River notifications in that area particularly. Next slide, thanks. So increased arboviral transmission has been also associated with summer flooding. And this graph shows us, the years from 2019 to 2023, and it shows that you can see that January, February, March, April, May is when we have the highest sort of, incidence of disease. The 2020, the green graph, you can see April and May, it's really spiked, and it would have been present the monthly notifications in the eastern parts of Australia. I think at that time we experienced severe flooding. You can see that corresponds to the large increase in the notifications in April, May of 2020. And when you see that, like similarly, the large increase in notifications in early 2022 was following a severe flooding in Eastern Australia in late 2021. So understanding the patterns of, when we're seeing the flooding, as well as when we're seeing, the drought, and how that determines what we're going to see for the Mozzie season. So there's, a lot of information we have to take into consideration. Next slide. So I'm just going to quickly cover off JE, which is from my perspective, I'll just talk about the disease, the notification process, and then Belle will go on to cover the vaccination. So JE, before 2022, Japanese encephalitis has rarely been found in Australia, with previous cases only noted in Northern Australia, Cape York and Torres Strait. It is not known why we've got Japanese virus on the mainland of Australia. We don't understand exactly why, but the movement of infected mosquitoes and the water birds may have played a part in the virus spread, combined with significant rain events. So Japanese encephalitis has now been detected in pigs and humans in Western and Southern New South Wales, as well as Queensland, Victoria and Northern Territory in South Australia. First detected in 2022 in piggeries in mainland Australia, and then our first locally acquired case in Southern Australia was in March 2022. Next slide. So on March 2022, the Acting Chief Medical Officer actually declared JEV a situation of, significance, which is for a notifiable disease. That's quite a big thing in public health. And as you can see, with regard to the case numbers, which I think I have a slide further on, it became evident quickly that there was an issue and a problem with this emerging disease for Australia and for the states that I just mentioned, because of I think, the severity of the consequences of Japanese encephalitis, and that, for many, many years, we hadn't seen any cases in Australia. So the quick action was to stand up a lot of information sessions, education sessions, surveillance, and understanding what we were seeing, and then to provide that information through to the public health units. Next slide. So Japanese encephalitis is a mosquito-borne disease. It does not spread directly to humans from water birds or pigs. That's really important, or other humans or horses. So we can't spread it between one another. It is only spread to humans by the bite of a mosquito. And once a pig or a water bird is infected, that's what we call the dead end host. So the mosquito feasts on the pig or the water bird, and then goes off, and within about a 5K radius is as far as the mosquito can fly before its little wings just won't carry it any further. And once it's, got to its destination on a human body part and bites them, that's when it can spread, and only then can it spread the disease. So when we hear about pigs being identified as positive for JEV, a Mozzie can't fly to the other state and infect somebody. It can only go a small distance. So our efforts are concentrated in that area. The problem being is obviously birds can fly a lot further, and then the mosquitoes in that area can bite those birds, and then, obviously the illness can be spread on, the virus can be spread. But you can only catch JEV or arboviral infections from a Mozzie bite. You can't catch it from another human. You can't catch it from water birds, horses, or pigs. So that's a really important message, and one to understand how we can sort of, concentrate our efforts on the Mozzies. Next slide, thanks. So just back to the JEV numbers. So we did have 13 cases notified across sort of New South Wales. Unfortunately, there were 2 deaths associated with those notifications. And so we've not had any cases to date this year. And I think for us, it's really putting all those surveillance systems in place to determine what we need to do with regard to alerts and things. So I'll just go to the next slide, which describes what we do from the public health perspective. So we have control guidelines. So if we get a case reported, which is the only way that it's reported to the public health unit is via phone, if one of the GPs or one of the ED doctors suspect, or via the notifiable disease database NSIMS, which is a lab result, and that comes through to the public health unit. And we need to determine whether it's a new infection or whether it's an old infection. We're guided by guidelines, and they basically give us a script about what we need to do and how we determined what we're dealing with. And it's quite complex. Next slide, thanks. So the public health management, as I sort of indicated, the process of determining whether we're dealing with a confirmed case or a past infection, we use a positive blood test is the first thing. We also want to know what symptoms you had, and they would include, symptoms like you've got a flu. Typically, when you interview people that have had an arboviral infections and they've got an illness, as you can see there, 99% of people with Japanese encephalitis don't have an illness. But your arboviral infections, a higher percent present with this fever, feeling unwell, joint pain, Typically with this JEV, it's neurological symptoms ranging from headache to severe meningitis and then going on to encephalitis. Unfortunately, that in between where you've got no symptoms to this rare result of being bitten by a Mozzie infected with JEV, there's a 1% chance of that really, disease that causes significant illness. And quite often the public health unit will not be notified of a case until they're in hospital, and subsequently it's a notification after the event. So it's trying to get the information and to determine what stage of illness they're presenting at when we receive the notification. There's no treatment, and that's with all arboviral infections. There is no vaccination. That's not treatment, that's prevention. There's no antibiotics, was what I was meant to say. And there's no, antivirals. There's only treating the symptoms, and that's usually paracetamol for those mild infections. And you then, with other systemic, so when severe disease is identified or somebody is unwell in hospital, the things like meningitis and encephalitis are treated to keep that person alive, basically, with all of the treating the symptoms of the infection. That's really, really important. Next slide. So one of the things we do is we phone if the notification comes through to the public health unit via a lab result. We will phone the doctor and phone the case or the carer and complete a questionnaire. The information that we're asking is their symptoms, what type of symptoms they've had, when the symptoms started, where they were, how long. It's really important to determine, if they've got symptoms and they were bitten by a mosquito, when they were bitten. So, determining the time frames, understanding that not all notifications with a positive result means that this is the time that they're infected. So if they didn't have symptoms or they don't recall being bitten, did they have something last year, the year before? Can they recall a previous illness that wasn't followed up? So there's a very specific questionnaire. We basically ask those questions. Somebody on this meeting today may have been contacted and may have gone through that questionnaire. The information collected from the case is entered onto our database. All that information goes towards understanding and managing these diseases more thoroughly, and understanding who is at risk and what we need to do. And the information is also used to count the number of cases and to identify where they got infected. It's quite a long process, a lot of this. Yes, thanks. Next slide. I think provide advice and prevention is the cure. It's the only arsenal we have in our toolkit. Belinda and I talk a lot about our toolkit because we're always reaching in to find the tools that we need and to help people find those tools. And the spray up, cover up, clean up, screen up campaign is one of the, prevention is to keep mozzies out. And mosquitoes can bite through tight clothing. You need to cover up while you're outside, wear loose, long sleeve, light clothing and covered footwear and socks. I know even saying that in 40-degree heat, a lot of people are not going to wear that clothing, particularly if it's, you can't if it's 40-degree heat. So it's about applying mosquito repellent evenly to all areas of exposed skin, using the most effective repellent, which is, I think the one is DEET, or oil of lemon eucalyptus. Now, I think that importantly, from my understanding, it's got to have that DEET, that you know, really high value pesticide, which, let's face it, that's what's going to work. So we need to use the mosquito repellent that's most effective, and reapply it. So always reapply. It's a bit like sunscreen. Maybe it's something you use in conjunction with sunscreen. It's the wristbands and patches. I think there's a lot of those that are not recommended, as there's no evidence that that they provide good protection against mosquito bites. So I think the intention, if you've got those things or you spend money on those things, natural or homemade repellents provide limited protection against mosquitoes. So understanding that and being able to provide the proper advice as to where you can get it. There is programs that the environmental health team and public health deliver the Mozzie repellent to local councils to distribute in areas where there's a concern, or just for general purpose. So there are places that can be accessed, and people can, you know, if people know about it, that's what's important. That's going to be our tool, you know, in that kit. And I suppose where possible, if we're not going to clad ourselves from head to toe with long sleeves, boots, socks, then limit outdoor activity when there's lots of mosquitoes around, particularly around areas like swamps and wetlands. I think if you're going to be hanging around swamps and wetlands in the evening, then you need to put everything on. You know, that's a given. But in your home, make sure that you're, you know, in the evenings that you can stop the mozzies from getting inside the house. Put the repellent on and ensure that you've got access to repellent, or people, family members have access and know how to use it properly. And when you're, you know, you're going outside, just think about it. And if there's lots of mozzies, yeah, maybe think about going inside. Understanding when the risk is helps you to make those decisions, I think, most importantly. Next slide, thanks, Erica. One of the things we do as a bit of a tool is media releases, and you'll see this. So when a significant event, or there's been something that we think the public need to know about, importantly, a case is confirmed of JEV specifically, we will send a media release. And it will only be from that media release that you can confidently be assured that that case is confirmed. Any whisperings in the community about a positive case, it will only be confirmed via New South Wales Health and via a media release. So if people have got concerns about circulating virus and they're not sure, please give the public health a ring or go online, because it will the information's all there and available for everybody to access. And I think really from that, the most important aspect is that surveillance and understanding the disease and what prevention activities we can do to prevent infection. So on that, I'm going to hand over to my colleague Belinda, who's going to have a chat about the JEV vaccination. Thanks, Belle.
Thanks, Kathy. Wow, that's been a lot of information. I hope everyone's enjoying it so far. So as Kathy has highlighted, these arboviruses are far and wide, and unfortunately there's only a vaccine available for Japanese encephalitis. So that's our only preventative vaccine available in this space. So since JE, which is short for Japanese encephalitis, has been circulating New South Wales, eligibility has changed. So these vaccines are not new. They've always been available for people to have if they're going to be travelling to Asia, for example, where JE is endemic. So we're not dealing with new vaccines like we were in COVID. So I hope that we can send that message that these are tried and trusted vaccines and we can promote the use of them. What is new for New South Wales is that we've got access to them as a free vaccine, so that the government's actually providing these. So they're quite a costly vaccine. So we need to meet the eligibility criteria. And as you can see, it's quite lengthy. You'll get a copy of these slides, so you'll be able to access these details. But it's generally targeting our children 2 months and older, people who live and work routinely in outdoor areas with lots of mozzies about, people who are living in homeless environments, people with limited protection, so they can't put a screen on their window because they might be living in a tent or a caravan, and the SES workers or equivalent who are working in those flood recovery areas. So we strongly advise anyone working in the outdoor areas, including piggeries and farm workers, and around swamps and rivers where the water is plentiful, they're really encouraged to be vaccinated against JE. And it's also targeted to lab workers who might be taking those squished mozzies for our surveillance program, and they may be exposed to those. So it's quite broad. So it's been an evolving thing since JE became a problem in New South Wales. So there is, because of the updates that do occur, we've just popped a link there down the bottom, so you can constantly keep abreast of what the changes are. Amongst all of these individual criteria for you to be eligible for a free vaccination, it's also LGA based. So I think the next slide, Erica, gives us a bit of a map there of the LGAs of high concern. This year, it has been expanded a little bit further to include 3 new LGAs. So you can see there from the Queensland border, the South Australian border, and the Victorian border that far west area has always been incorporated. So it's just moving gradually east. So the new areas are Cabonne, Orange, and Midwestern. So including, those Forbes areas and bits and pieces, as well as coming down to Mozzie and Orange. So I'm sitting here in Bathurst, but we're still not eligible for a free vaccine unless we're travelling into the LGAs of high concern for work. So that's something to be mindful of too. If you're outside of an eligible LGA, but if you're talking to someone who might work for the SES and they live and work predominantly in Bathurst, but they do the flood recovery in Walgett, for example, they may be eligible to have a JE vaccine, and I strongly suggest every single GP practice and pharmacy have access to these vaccines, so it's readily available when you might encounter someone at your clinic that may be eligible to have these vaccines. So it is a big chunk of our district, so I think this is the importance of us sharing this knowledge with you. What's the next slide there, Erica? So these are the tried and trusted vaccines. It's all a supply thing, I suppose, and that's why we've got a couple of different names. So Jespect and Exario, they're the same type of vaccine, just a different manufacturer, okay? So these doses, that's a 0.5 dose, it's an intramuscular injection, and then the Imajev is a single dose, but it's what we call a live vaccine. So on that little table there, I don't know if everyone can see it well enough. It's lovely and clear, and on our immunisation handbook, you can get further information about this. So basically, the Jespect or Exario is a 2-dose course, and traditionally about a month apart between dose 1 and dose 2. So there's different criteria. So that's, again, part of that assessment process. When you've got someone inquiring about Japanese encephalitis, we have to look at their medical history, what age they are, etc., etc. So it's clearly put on a lovely little table, so to help in that decision-making process. So I hope, that makes it nice and clear and easy. Again, it's just a case-by-case assessment, but predominantly we need to be confident in reassuring people that these vaccines have been around for a very long time. They're very trusted, they're very safe. People have been paying lots of money to have them so they could travel overseas. So the opportunity to receive a free vaccine is, it's fantastic. But as Kathy's highlighted, we've only had a few cases, thank goodness, but we need to protect against the potential of the fatality of the Japanese encephalitis virus. So we need to sort of put that spin on things, that prevention is still better than the cure. And as much as our percentages are low, the risk is there for everybody in our communities. What's the next slide, please, Erica? The public health unit, at the height of when JE really rocked in, before vaccine was available readily in all of our GP clinics, we scooped up some vaccines from the ministry, and we started plonking ourselves into our communities that were eligible for free vaccination. But this was also hampered by the extensive flooding that the statistics showed you there. So we resourced some amazing people across our district, and we started getting our vaccine distributed as best as we could. We did some pop-up clinics to get the ball rolling, to get as many people vaccinated as quickly as possible once it had been declared a disease of significance for our state. So once again, our amazing workforce really did step up, and we got a lot of clinics done and a lot of people vaccinated, which was fantastic, because it was at a point where people were a little bit fatigued from vaccination post-COVID. So to try and promote people that, these were safe vaccines, and of particular concern because of the flooding and the Mozzie production, the occurrence of Mozzies was phenomenal. So it was hard. So down the bottom there on the left, Merv, I'll give you a shout out there. We engaged with the SES, and I got Merv on that helicopter in the middle of the photo, and we got out to a small community called Uwabalong, and so we sort of went to the nth degree to try and make the vaccines get out and about as best we could. But yes, the floodwaters did hamper it, but we managed to get a few clinics done, and it was, here we were post-COVID thinking, you beauty, we're going to have a lovely summer, and then JE came along, and it was a bit like deja vu. But next slide, please. I suppose this is a little bit of a repeat, but I suppose it just highlights the fact that yes, our numbers are not big, and unfortunately we have had 2 deaths. So again, it's our working people who work and play outdoors, they're at the greatest risk. And that picture down the bottom there shows our river systems, and that traditionally sort of indicates that intense mosquito level that we're monitoring as much as we possibly can. The picture on the right, that's Mozzie trap. So that's what Kathy was referring to with the EH team collecting Mozzies. So they're quite a decent size, but look at all those revolting Mozzies. So they have all been squished and sent off to the lab. So good riddance to those Mozzies, I say. So we really do value our Mozzie testing to give us a bit of advance warning where these nasty diseases might be cropping up, or the virus living in mosquitoes is currently happening. So the next slide, please. And again, it is the importance of vaccination against JE, and it is important that, yes, we offer that JE vaccine to everyone that's eligible, but again, send that message that mosquito bite prevention is key. There's a lot of fabulous posters, toolkits available. So here's just a few more of those. There is going to be some information after this presentation to for you to take home with links to all these toolkits and all these posters. So we just got to keep promoting that spray up, cover up, screen up to prevent mozzie bites. Next slide, please, Erica. This toolkit here, it's actually a PowerPoint presentation that everyone can access, and if you wanted to run an education session, you can use this as a template, and it's there for you to fill in your local information and what you want to take. So it's just a handy tool which I wanted everybody to know about. Next slide, please, Erica. Again, we've got access to lots of fact sheets. So, you know, these are sort of things that you can print off and carry around with you if you wanted to promote education and information about the arboviruses that we're dealing with. You know, or if you're sitting down with someone to talk about the vaccines and whether they're safe and what they're doing, you can have that information sheet about Japanese encephalitis with you, so you've got that information on hand, and that's something they can take home and spread the word to their friends and families to say, you know, go and get a vaccine. It's simple, it's straightforward, and it's free for the eligible LGAs. So again, there's going to be links for you to tap into these posters, fact sheets. I think it's great for you to all get a copy of them, read them, be comfortable with their content. So it's an easy conversation with the people that you engage with. Next slide, please. This is just a bit of the vaccination distribution. So, you know, it was all pretty low key to begin with because it was just targeted to our people travelling to countries of where JE is endemic, and then suddenly it spiked up and we had doses flying out the door, so which is fantastic. So I suppose it's something that we need to keep promoting, especially we need to start having the chat primarily definitely through the summer months, but leading up to the summer months, because all vaccines need some time to actually be in the body, developing the antibodies to protect against the virus that you're trying to do, which is JE in this case. So our flooding along the Murray River certainly allowed a greater uptake of vaccines, which is highlighted by the dark blue. So they're the most highly vaccinated people against JE currently. But as you can see, those the state map there on the right, we're definitely increasing our vaccination rates in our district as we go along. So, you know, there might be some more work to do, but I think it is just about having that conversation amongst our communities to promote that the vaccine's available and it's free at our GP practices and pharmacies. Next slide, please. Here we've got a little video. So Erica, I'm going to hand this over to you. So this is just something that you can use to, you know, promote to your communities. It's a short, easy demo on what we should do with mozzies, and that's to swap them. So over to you, PHN.
It's just no sound at the moment, Zach.
The sound on that, sorry.
No.
Easy fix. 1 second, guys. Alrighty.
Mozzies aren't just annoying. They can also pass harmful viruses onto humans like JEV. So when you're travelling about, protect yourself by using these 4 SWAT for safety tips. S is for screens closed. W is for wear clothes that cover up, especially at dusk and dawn. A is for apply effective mozzie repellent. And T is for tip out dirty water. Help keep our mob from getting really sick. SWAT for safety. Find out more at health.gov.au. Authorised by the Australian Government, Canberra.
So yeah, as you can see, that's a really short and easy promotion tool to just get people to start thinking about getting rid of those mozzies. So I suppose that's it in a nutshell. I thank Kathy so much for stepping up and sharing her knowledge about arboviruses and what they mean to our communities. JE is, it's a new problem, but I think we've definitely, we've had it around for a couple of seasons now, so it's becoming a little more familiar in our conversation. So I just implore you all to try and take this information, use it and spread it widely so we can get our populations vaccinated against JE, but also preventing arboviruses on a whole. So I think we can declare the presentation over. So I'm sort of keeping an eye on our chat. There hasn't been any questions popped in there during the presentation, but we can certainly open up to our yarning session. Alice, are you off mute? And Wendy Holmes, I'd like to introduce everybody to Alice and Wendy. I am pretty confident that most of you would know these wonderful women that I have the pleasure of working with. They work in our immunisation sector, but I think I will hand over to both Wendy and Alice. I'm going to keep an eye on the chat to see if there's any questions come through there. But if you've got a question, please unmute yourself and pop your hand up perhaps, and I'll let Alice and Wendy determine how they want to go with that. So yes, just
hello, I've got my hand up. Before you go into the yarning session, can I just ask a couple of questions? It's Pat Burke.
Sure.
I see on the map when you've done the vaccinations, you chose Cobar in the northern sector. Cobar's not on a river, so I'm just trying to work out around the flooding. And obviously last year we had extensive flooding at Bree, Burke, Walgett, Wilkenya, but they weren't the communities that were identified for the opportunity to be vaccinated. I do see where you predominantly you've done those, and they're large Aboriginal communities, and that's why I'm asking the question. And down in the far west, there were some large Aboriginal communities there that you obviously done the vaccination in. So that's one question. The other question is there an opportunity, or is the video on our Facebook site? And is there any sort of opportunity to go to Imparja TV? Because a lot of these communities in Western New South Wales, Imparja is our main media outlet, or you know what I mean, like TV.
Mm-hmm. For sure.
Because obviously, I'm just, thanks.
No, that's fantastic questions. So sometimes we sort of stepped up in some communities such as Cobar because there might not have been a provider available. I know that, when we were doing the pop-up clinics, it was actually the flooding that prevented us getting to our northern sector. At the time, we were trying to get there, but we certainly put some.
Helicopter into your Avalon there?
Sorry, can you say that again?
I thought you said that you were able to helicopter into your Avalon.
That's right, and we use the SES in our northern sector with boats to move vaccine into Walgett, for example, and the providers in Walgett. The vaccine was sent to the local providers there. So, there was what we could do was, try and get vaccine in as many fridges as we possibly could. And then it was, being able to access those providers. So it certainly wasn't a perfect scenario, but we certainly used the SES to boat vaccines across when it was safe to do so, because we had to maintain the cold chain as well. So distribution was very difficult during the floods. So it certainly allowed us to backstock some vaccines. So the minute those roads were open again, those trucks distributed the vaccine directly to the providers in the towns. But we could still get to Cobar quite easily. But Burke, Bree up there, the roads were closed, unfortunately. So
I know, that's great. I guess then the other part to that was it's informing the community that the vaccinations are there. I'd like to think I've got my ear to the ground in Burke and in this northern sector in particular, but I didn't hear about it, but it could have happened, you know. My colleagues were sort of asking the same question around the communication, you know, letting the community know that there was vaccinations available. But anyway, look, it's something for us to look at for next time anyway.
And I think that's the purpose of why we've started this, Pat. So we've got that. We're aware then of who's who in the zoo out there, and we've got our trusted community champions. So if we've got this scenario again, we've created this network of wonderful people that we can ring and go, hey Pat, who's out there? Who do you know, what's going on? And I think that's the benefit of engaging together, so we can identify who our champions are in every single town. And as far as the video to go on to Impaja, I can certainly ask the media team from Western and Far West, but whether or not there's someone else from PHN or the district that might have other suggestions about that, but it is a really good suggestion, Pat.
Even our media page, and then the workers can, I think you can copy it then, can't you, on your own, like Burke information. Yeah, you can share it onto your local website then, or, you know, whatever they're called.
Yeah, and you'll all be given a link to it.
No, great, thank you.
Yeah.
Cheryl, you're on mute.
Shirley-Anne, you've got your hand up.
We can't hear you,
hi,
Cheryl,
Shirley
sorry.
Condo here. We were just wondering about the vaccination schedule. I know you had it up on the presentation, but we couldn't see it.
Oh, damn. I thought that might be the case.
Yeah, it was too small.
Yeah, and you'll get a copy of everything.
Yeah.
So basically the JEV, it's registered for use for kiddies 9 months and older. And so it's a live vaccine. So it's a 0.5 ml dose. It's a single dose. Okay, so that's that. And then the JESPECT is what we call an inactivated vaccine, so it's not live, and it's a 0.5 ml dose as well. It's registered at the moment for people 18 and over. There are a few little extra bits in there, but it's a 2-dose course, 6 months apart. Usually, if you are at high risk, there is some room for a faster schedule. So there's a bit to take into account, but that's broadly what the schedule is. So so it's back up there now, whether or not we can, so the first line
Yeah,
there
I can see it. We can see it, but it's not very big.
Yeah.
So basically for adults, it's 2 shots, one 6 months and one, and then the second one 6 months after.
Sorry, it's a month. Sorry, I was reading something else. So if you're going to do the 2-dose course, which is primarily the normal vaccine, it's 2 doses a month apart. So, and then the live vaccine is a single dose. So they're both available, and the doctor just needs to do a bit of a review on what's the right vaccine for the person.
Right. Thank you.
Bill, it's Erica. Would you like me to include that table on the resource page that we're sending out?
We
That'd
can.
Be great. Thank you.
But we've also included the link to the page in the immunisation handbook, which is probably more appropriate because the schedule can change.
Yep.
Yeah. So, you know, what we say today might be different in 3 to 6 months' time. So it's important that we keep accessing, you know, the resource where, not printing stuff off and putting it on the wall, because things can change, and that's how we can get out of date pretty quickly.
And we've just got a question in the chat asking how do mosquitoes get JEV?
I'll put my hands up for that one. Those little pesky mosquitoes, they go on.
Oh, sorry, we can't hear you very well, Kath.
Maybe because my little headset's been.
There we go. Yep.
Is that better? Those pesky mosquitoes bite either the infected water birds or infected pigs, and sometimes, rarely, horses. And they then go and fly around and find a human to feast on. And it's actually passed on via saliva. So when the mosquito bites into your skin, it injects a little bit of saliva into the blood, and that's how people catch all arboviral infections, not just JEV. I'm sure there's people out there, you know, you can hear it in your friends and family. I'm always getting bitten by mosquitoes. They love me, you know, they bite me more, and then other people, they never bite, and that is actually true. And some of the rationales or some of the things that I've heard is a certain blood type attracts mosquitoes. If you emit carbon dioxide from your skin, you can attract mosquitoes that way. If you're pregnant, and I have also heard beer consumption attracts mosquitoes, so maybe they like a bit of a drink as well. But yeah, it is only passed on from that end host. Then the mosquito passes it on to as many humans as they bite, effectively transmitting the virus. They only live for about, I think, 3 months, if lucky. I reckon if a mosquito bites me, they're not going to live very long. So, you know, let's just swat them and not let them pass on diseases. That's my, you know, I think I've also heard that a mosquito will bite somebody that's positive with JEV, then pass it on. Well, it doesn't kind of work that way, because you've got to be bitten, get infected, which takes up to about 14 days for you to become infected. By then, the Mozzie's infected many people that were sitting around you at the same time. So it's a time and place, and that's why we want to know where the pigs are testing positive, where the Mozzies are testing positives in the areas, so that we can give people warning to protect themselves. I hope that's answered your question.
Bill, I was just wondering if Cheryl still had a question. Still can't hear you, Cheryl. Do you want to type it in the chat, Cheryl?
Well, Mello's having a terrible time.
Mello can't hear either.
Oh, Alice has saved her.
Oh, good.
Move into the next room. Okay.
So we might move on then, Bill, to the yarning session.
For sure. Wendy and Alice.